In this video, we're going to demonstrate soft tissue release cupping technique to the latissimus dorsi muscle group. So the latissimus dorsi is one of our large back muscles and it's involved in extension of the shoulder. So the latissimus dorsi starts off quite fascial down here in the lumbar part of the back, and it's a broad muscle as it comes out to the side and it connects into the humerus bone just below the shoulder area. We can see it's one of our largest back muscles, and as we mentioned, it's involved in the movement of the shoulder. So when it comes to the placement of our cups, we're aiming to place the cups over the latissimus dorsi on the back. We could do both sides of the back at the same time, or we could do one side of the back first and then move our cups around over to the other side. Okay, so first of all, we're going to place the lotion onto Katie's back. Okay, so we need our lotion to help our cups to stick to the tissue and to create that vacuum effect. So today I'm using the physique lotion, but you could use oil or you could use wax as well. It doesn't really matter what medium you're using. So I'm going to place the medium onto Katie's back. The medium doesn't need to be fully absorbed. You can take some time massaging that medium in, but as long as it has left that film over the skin, then that will suffice. We can see that Katie's already been cupped previously, as we've got a couple of examples of these cupping marks on the back here as well. So these cupping marks might just last 1 to 2 days, and these cupping marks here are only going to last a couple of hours. We just want to be mindful of the colour coming into the cup, because we don't want to leave our clients with marks that are going to last more than 10 days. And if they're going to be really dark, purpley, blacky-ish in colour, they're going to last quite a few days, possibly 10 days or longer. The first treatment, they're going to mark more, and then as the client gets used to the cupping effect, they won't cup as much and or they won't mark as much, and those marks will fade more quickly. Okay. So we're now going to place the cups onto the clients. So we want, because of the nature of the latissimus dorsi, it's involved in extension of the shoulder, we want Katie's arm to be in at the side of the body. This then puts the muscle in that shortened and relaxed position. Then what we're doing is we're following the line of the latissimus dorsi muscle. So we know that it starts more fascial, nearer to the center of the spine, and then it fans out towards that shoulder area. So the cups are going to follow that line. These are the Dongbang vacuum cups that I'm using today. Okay, I'm putting 2 pumps into each of these cups. Katie is used to being cupped, and I know that's within her tolerance level. So we don't want the cups to be painful when they're on the back. So making sure that we're asking the client how they feel. The more cups we've got on the back, the stronger the cupping effect is going to feel. So it will feel stronger to the client. So we want to mix and match the amount of suction that we're putting into the cup along with the number of the cups. If we wanted to increase that sensation for the client, I could do a double line here as well, following that latissimus dorsi line. Then we know that Katie's going to do a movement. Okay, she's going to do this actively today. We could start off passively by moving the limb ourselves first so that the client knows which movement to make, or we can just explain the movement that we want them to make. But before she starts moving, I'm just going to double check all of these cups are on nice and securely, and if I need to, I could put slightly more suction into them, because as soon as we start moving, sometimes those cups start dropping off. So the first technique we're going to do is abduction and adduction of the shoulder joint. So Katie is going to take her arm from the side position here, and then she's going to stretch her arm out to the side and above the head as far as the joint is going to allow her to go, bearing in mind that these cups here are going to be restricting her movement. Then she's going to bring that arm back down to the side of her body. And then again, we're going to repeat that 2 more times. We're going to do 3 movements in total first of all, and then she's going to come back. And then again, when she's ready, so the first movement might feel quite restricted. And then as she repeats this movement, that stretch reflex should kick in and the movement's going to feel easier for her. If the client had quite a lot of restriction in their movement at the shoulder, we could repeat this up to about 6 or even 8 times. Okay, so that's the first movement. Some clients will prefer this adduction and abduction movement. Others might prefer what we refer to as the Superman movement. So in this instance, Katie is going to place her arm onto the couch here. So the arm is still close to the side of the body to start with when these cups go on. Because Katie's already done a movement here, her tissue would have relaxed slightly. So I'm just going to put a little bit more suction into these so she can feel that stretch effect. And then this time, Katie is now going to literally stretch her arm above the head. Excellent. And then come back down to the side and then stretch above the head and back down. And one more time. Brilliant. And back down. So some of your clients might not feel any difference between those two techniques, and some will feel one more beneficial than the other. Some of your clients might find the Superman one produces a stronger stretch. Others might find that the abduction and adduction one, stretching their arm out to the side and then coming back down again, will produce a stronger stretch. So for the first time that I use this technique with my clients, I tend to use both stretching techniques first and then stay with the one that they find is more effective for them at that particular time. Then we're going to take these cups off. So releasing that valve at the top to take those cups off. And then we're just going to flush that area out with our effleurage massage technique. So it's always nice to do a little bit of effleurage first as you apply that medium and then flush it through afterwards, because as we're flushing through afterwards, we're feeling for that change in the tissue, and that's going to tell us whether we've reduced that tension enough or whether we want to follow up with more manual massage techniques or with a different cupping technique. So just to summarize here, this was the soft tissue release cupping technique to the Latissimus Dorsi muscle group.